Hi, everyone. My name is Hanna Zafar from the University of Pennsylvania, and I want to talk to you about dissemination and scaling for AUR grants. What is dissemination? Traditionally, we think of dissemination as targeted distribution of information and intervention to a specific audience, whether that's a public health audience or a clinical audience. Why is it important? Well, at a very basic level, dissemination really demonstrates value not only to your audience, whoever they may be, but also to your funding source. Dissemination can include shared learning, what worked well about your project, or just as important, what would have been even better if. Dissemination, when done well, can drive demand, both through feedback that you receive from your audience, but also the amplification of your work that your audience performs themselves. So, for example, patients who are attracted to a concept that you have may in fact drive demand by going to funding sources and policymakers to ask for more research in that area. And finally, understanding how your concept will and will not scale, which is something we don't see a lot of consideration given to in some of the grants we've received historically, but is a very important part of the process in writing grants and something that we hope you will pay attention to. When you're thinking about how to create a dissemination strategy, it's good to have a framework. And here I've put up one of many frameworks that includes 5 different components. So first of all, who is your audience? Who needs to know the information that you are distributing? And I would encourage you to think not only about your audience in the healthcare field, in academia, but also to think more broadly about some of potential stakeholders who might be influenced by your work outside of the university setting, so non-academic providers and even patients. Number 2, context. What do they need to know and how can you make it clear to them? So, for example, a Kaplan-Meier plot might be easily understood by a provider, but would not really carry a lot of clarity for a patient or potentially even a local healthcare worker in the community. Number 3, source. Who do they need to hear it from? Do they need to hear it from a provider? Or again, would it carry more credibility if the message came from somebody else, a trusted local source or another patient, etc.? Number 4, the vehicle. How can this audience best be reached? Again, we traditionally think about medical journals, but if you're thinking more broadly about your stakeholders, that might include other mechanisms of reaching patients and non-academic providers, potentially social media, TV, radio, etc. And then finally, your context or environment. What might influence or who might influence the attitude of your audience to the message that they are receiving? Some of the common weaknesses and opportunities that we see for dissemination and scaling, for example, applications that focus on low intensity or passive approaches that are targeted solely to the academic community. Again, we're talking about papers and presentations. There's a real opportunity here instead to leverage that and do more active engagement of patients and providers outside of academia who again are going to be part of your key stakeholders and are not traditionally acknowledged in many of the grants we receive. We're thinking about social media, community outreach, even YouTube, radio, etc. Secondly, the absence of consideration to scaling results in study design. Many times we receive applications that are focused on a single site. And we would encourage you to think about how you could think about the generalizability of your study design up front. So could you try to pilot it in 2 different sites, maybe 2 different sites that are different? One could be in a urban environment and one could be rural, or maybe one is a large academic program and one is a smaller hybrid program, or potentially something, a hospital or a care setting that's even out in the community. Third, exclusion of local resources or expertise. A lot of times we get grants from very large universities, from PIs in very large universities, but we don't see consideration given to collaboration with researchers in other schools or departments. And if you're in a smaller program, you could even do this virtually by collaborating with somebody in another healthcare setting or another radiology department, or maybe even a non-radiology department. For example, if you're submitting an education grant, could you work with somebody from the School of Education in your university, or somebody from the School of Communications, etc. Fourthly, exclusive use of quantitative data and or surveys that are put together quickly. So instead, could you think about gathering qualitative data, which might be more robust and meaningful, and reaching out to get expertise from somebody, again, either at your university or elsewhere, who could help you with understanding how to design your study in a way that you could gather this data and use it, or the more thoughtful use of how to use surveys in conjunction with an expert in survey design and dissemination. So instead of thinking about this traditional model that we started off with for dissemination, I would encourage you to think about an alternative approach to dissemination, where you might actively solicit feedback on your trial design and even your results from targeted stakeholders to inform your study design, your aims, your objectives, either in the initial iteration or even in the second iteration. So in summary, an ideal dissemination plan should be clear and brief. What do you want your key take-home points to be? That's something you're going to think about even as you are designing your study, at which time you may not know what your key take-home points are. But again, how are you going to plan to take those points and disseminate them once the study is underway? Because again, dissemination does not have to occur at the conclusion of the study. I'm encouraging you to think about even disseminating results before they are fully formed, at a point where they might be able to more readily inform your study design, and that you might be able to incorporate that feedback. Number two, a multifaceted approach. Instead of the traditional, we will publish our results in papers and present at meetings, thinking about alternative avenues that might be more appropriate for what you're doing. Community outreach, radio or TV, social media, or maybe you even want to think about publishing or presenting in non-radiology journals that are more aligned with your particular project. So something that's in the field of informatics or education, might there be an audience outside of the radiology journals that you could reach to for that? Number three, who is your key audience? And you want to, again, think broadly, not just academic providers, but also patients, or maybe community or non-academic providers. Could you try to solicit feedback from community health workers, private practice providers, etc.? And finally, actionable. What do you want the audience to do with the information? Are you looking to get feedback from them on how you can revise your study? Do you want them to disseminate the results? Do you want them to give you feedback on how you can do the second or third iteration of this particular trial? And then also have a plan about how you're going to use that feedback and put that plan into your grant. Thank you again for your time, and I hope that this video was helpful.